subretinal drusenoid deposition, I think there has been a lot of discussion about this since morning, including Dr. Rajiv talking about the type 3 CNVM. And so, as Dr. Sadda mentioned, this was started off as pseudodrusen that was seen better in blue light reflectance. Has got several names, including pseudodrusen, reticular drusen, reticular macular disease, and so on, although commonly either referred to as reticular pseudodrusen or subretinal drusenoid deposits. Is it common? It does appear so, because a couple of studies have shown that nearly 40% of people over the age of 80 with so-called no AMD actually have these pseudodrusen. And the age-related maculopathy study showed that with early AMD, the prevalence was more than 50% people. It seems that older women who smoke probably have the highest risk. So I think a lot of people here are spared that. So that's the blue reflectance, the multimodal imaging we've been talking about. That's the blue reflectance with the drusenoid deposits. In a typical clinical picture, this is how they would appear, sort of yellowish, greenish deposits. That's the red-free, the infrared, and the autofluorescence. So clearly these are more visible in the lower down panels than just the clinical picture. And there are some specific characteristics. Starts off in the superior macula mostly, and typically these are associated with the rod outer segments, and therefore they do not appear commonly either in the fovea or in the peripapillary region, which are rod-free. On the SDOCT, they appear as these granular deposits between the RPE and the ellipsoid zone. And they sometimes show these classic choroidal stripes. They're just allowing light to pass through, although they're not pathognomonic of SDD. Suzuki et al. Divide them into 3 different types: the dot, the ribbon, and the mid-peripheral types. And while the CAT trial divide them a little differently as the dot, reticular, and the confluent pseudodrusen. So this is a patient with extensive dot drusen, and that's an infrared of the same patient, with these lesions being called the target lesions. The central bright area referring to the drusenoid deposit themselves, with the surrounding darker area corresponding to the photoreceptors. That's the ribbon pseudodrusen and the confluent pseudodrusen. They've been staged currently into 4, started off as 3. It's now being staged into 4 different stages. So clearly then they progress. So this is a schematic. That's a schematic and the OCTs. That's the normal OCT. Stage 1 with the granular deposit. Stage 2 is where the photoreceptors get draped over the deposit, while in stage 3, there is a loss of the photoreceptor around that. Stage 4 is when these deposits disappear. That's to show the progression over 2 years. So that's an area where you have a progression from stage 1 to stage 2, similarly, and again a stage 1 to stage 2. And that's an OCT that shows over 2 years progression from stage 2 to stage 3, where you see the loss of the ellipsoid zone around that. Stage 3 to 4, where there is a resorption of the drusenoid deposit. Now, this is an area where the drusen have progressed to have areas of geographic atrophy, and that's an eye which has progressed to have a choroidal neovascular membrane. We heard enough of the type 3 lesions, so most of these go on to develop type 3 or the RAP kind of CNVMs. There have been, interestingly, histopathological studies with these, some of these patients, and this is a schematic diagram that shows the retinal pigment epithelial cell. That's the rod outer segment and the subretinal drusenoid deposit just under that. I'm not sure if that's easier. Okay, so this is an in vivo picture of the same patient, which shows the multiple drusenoid deposits, and those are the deposits seen. And that's a immunohistochemistry labeled retinal section. So that's the outer nuclear layer, the inner nuclear layer, the RPE. And you see these drusenoid deposits. This drusenoid deposit here, which is breaking through into the photoreceptors. That's a magnified view of the same, with the photoreceptors being draped over a 3D image of the same. And it's been shown that in areas where these drusenoid deposits are present, the outer nuclear thickness becomes lesser. That's to show the different stages. That's to show that the architecture of the RPE changes in the presence of the drusenoid deposits. See areas here where the hexagonal shape is extremely well maintained versus these where the hexagonality is lost. That's the H&E stain showing the the photoreceptor outer segments and the drusenoid deposits. So the composition is in some ways similar to drusen, although have some associated immune cells and so on. It's not exactly the same. Couple of theories behind the formation of these, either a choroidal theory or the RPE dysfunction. We yet to learn a lot about these. Now, why is it important? The Alabama study showed that there is a 2.25-fold higher risk of progression to AMD in the presence of these pseudodrusen, and there's a very high association with type 3 CNVMs and geographic atrophy. The comparison of the AMD trials also showed that neovascular disease was more likely to develop in these eyes, and it was an independent risk factor for geographic atrophy. Now, even in the absence of any of the changes, the visual function in these eyes is not the best. Their Besker visual acuities are lesser, with slower dark adaptation and lesser retinal sensitivities. There are other ocular associations that we've been hearing about, although there is a significant systemic association that's recently been known that these patients could have a higher risk for cardiovascular diseases compared to others. So in conclusion, a sort of relevant and a recent entity, a lot more work that needs to be done, but something that probably we need to look out for. Thank you.